Hi, good afternoon from gorgeous, sunny Seattle. Thank you so much for joining us today for Bringing Baby Home in the Time of COVID-19 with Swedish Medical Center's Dr. Elizabeth Meade. We're so happy to have you with us, Elizabeth. Dr. Meade is a practicing pediatrician and practices hospital medicine, caring for children and infants who are in the hospital. She attended medical school at the University of Washington and completed her residency at UCLA Mattel Children's Hospital. Dr. Meade is currently the president of the Washington chapter of the American Academy of Pediatrics and is also national spokesperson for the AAP. Dr. Meade is the medical director of pediatric quality and safety and the director of medical communications at Swedish Medical Center, where she splits her time between practicing clinical inpatient medicine, teaching residents and medical students, and various leadership roles. We are really appreciative of you being with us. Her greatest joys are caring for her children and educating families about how to do the same. My name's Elaine Sulkin, and for those of you not familiar with ParentMap, we are a content-rich resource, and we like to talk about the content we provide, ranging from broccoli, which we'll say is the education, health, wellness, and development content. So from broccoli to popcorn, which is the out and about fun adventures that we can kind of unearth some of the magical adventures that you may not know about. So check us out always at parentmap.com. We also publish a number of book titles, Getting to Calm, and we used to host live events, really live events, and now we have a very robust menu of virtual events. So check out parentmap.com, to see what those are. A few housekeeping issues. This live event is being recorded for future educational and promotional use. You'll notice at the bottom of your screen, there's a Q&A. So feel free anytime during Dr. Meade's talk to send us questions, and we will use those at the end. And of course, we really thank you for joining and zooming in, as we couldn't do this without you. We take a lot of pride in providing this kind of content, and we always invite your feedback about things you would like to see, who you would like to have us bring on, experts in any way. So thank you. And also, again, thank you to Swedish for your partnership here, and also to our other series sponsors, Leg Up, No More Under, Little School, and the Yellowwood Academy. So with that, I just want to welcome Elizabeth.
Hi there. Thanks for having me.
You're so welcome.
Okay, so I think we'll go ahead and get started, yeah? Super. So welcome everybody. Thanks for joining. I'm going to be giving you a lot of information today and talking a lot, and then certainly we'll allow time for questions as well. But we'll be presenting a lot of data and then hopefully giving you some reassuring information as well. I know this can be an incredibly stressful time. So I'm going to just share my screen so that you all can see it. Okay, how does that look to everybody?
It's perfect.
Okay, super. So as Elaine mentioned, I am at Swedish, and I am a newborn doctor and an inpatient pediatrician. So I take care of kids in the hospital, and I take care of lots of babies around the time of birth and right after they're born. All right. So first, we're going to talk a bit about pregnancy. And I think I don't know how many people in the audience are pregnant versus having just delivered or having an infant who's a little bit older, but we'll sort of span through all of those trimesters as they were, and hopefully talk a little bit about all of those times, which are lots of questions can come up. So I will say in pregnancy, there is some conflicting evidence for sure. And so I'll go through some of the data and some of the numbers, but I ultimately just want to say, first of all, that the bottom line is that all of this information is fairly reassuring, even though it can sound scary at first glance. So I wanted to talk about this recent CDC report. Lots of people have heard about this. I've certainly been getting a lot of questions about it in my practice. This is a recent report that sort of looked at rates of hospitalization and mortality rates in pregnant women versus non-pregnant people who were tested positive for COVID. So this report found that about 31% of pregnant women were hospitalized who were COVID positive versus 5.8% of people who were not pregnant. Now, at first glance, I think that can look worrisome, but I wanted to just break it down a little bit. I don't think that this is actually something that we should be super concerned about when it comes to pregnant women. So for one thing in this study, the cause of hospitalization was not specified. So some of that 31% of people probably were just hospitalized for labor and delivery and had gone into labor and were having their baby, not necessarily even hospitalized for COVID-related reasons. As we get down into those lower numbers, 1.5% versus 0.9%, so 1.5% of pregnant people who were COVID positive were hospitalized versus 0.9% in non-pregnant folks in terms of going into the ICU. So again, that's a pretty small difference. I'll also say I think some of those numbers have to do with the fact that we are just more worried about pregnant people than we are about some other groups of people. And we certainly are protective of our pregnant patient and also our infant or fetus patient as well. So I think that part of this is just reflective of the fact that we tend to hospitalize more and we tend to hospitalize in the ICU more when we're concerned about a patient because of their potential risk versus solely their clinical picture. There was very little difference in the number of people who ended up on ventilators, and there was absolutely no difference in the number of people who died. So I think those two facts are really reassuring and should just make us feel better when we're talking to our pregnant friends and ourselves about the risk of COVID to us. There are other studies that have shown that pregnancy may actually be protective if you're COVID positive and that people tend to get less sick if they're pregnant. So again, the bottom line is we just don't know. We don't have good sort of population level years and years of data, which for us in medicine is really always the gold standard when we think about studies that we can use to inform our care. There have been some suspicion that pregnant people may or may not be more likely to get sick. And that's partly because we know that the immune system changes in pregnancy. So often we think of pregnancy as a time where people are sort of immunocompromised or they have a suppressed immune system a bit. And so that always makes us worried that somebody could get really sick if they get an infection. But the interesting thing about COVID that I'll just point out is that we think some of the people who get very sick from COVID actually get very sick because they have almost a more intense than normal immune response to the infection itself. And so pregnancy in that case may actually be helpful if you have a little bit of a decreased immune system. So I think, again, bottom line is really to just keep calm about this. There is certainly no reason to panic if you're pregnant, but there's lots of stuff to talk about today and also with your provider. I did want to briefly mention what to expect if you're pregnant. So we'll talk a bit more about this, but you may get tested for COVID during pregnancy or near the time of delivery. I also want to point out that hospital staff are taking really extraordinary precautions when we have any patient who's hospitalized during this time, just because we're so careful not to spread COVID from patient to patient or from patient to staff. And then symptom reporting is something that's really important. So if you experience any of the symptoms of COVID, of which there are many, and they're unfortunately quite nonspecific, and we can talk about those, it's just really important that you let your doctor know right away if you are pregnant, because they may want to do testing, they may want to more closely monitor you for a little while. Those symptoms, just to really briefly recap, they can include typical things like fever, cough, respiratory distress, or difficulty breathing, but there's also some much more subtle signs. So some people report loss of taste or smell. Some people have primarily gastrointestinal symptoms, so vomiting or diarrhea. And then unfortunately for pregnant folks, one of those symptoms is fatigue. And so I think that can be very difficult to sort out. Are you tired because you're in your third trimester and potentially have other kids at home? Or are you tired because of COVID? And so I think anything that seems out of the ordinary or seems like a significant difference from where you have been is something that's really important to just share with your provider. So then we'll talk very briefly about delivery and that sort of process and kind of what to expect. So I will mention again, hospitals are taking really, really extraordinary precautions in order to protect all patients, but we are certainly especially protective of pregnant patients and newborns. So who gets tested? These are all questions, by the way, to talk about really with your own provider, because every hospital system is different, but I can share some sort of general guidelines and things that we're seeing. So in terms of who gets tested, that really varies based on the hospital that you're talking about. So some hospital systems are testing all people who come to the hospital for admission, including all pregnant people who come to deliver. Some hospitals are only testing pregnant women who are going to be induced or who know that they're going to have a C-section, because those two things carry a small increased risk of needing intubation or a general anesthetic for the procedure. And so it's important for the anesthesiologist to know if that patient is COVID positive. This is a great question to ask. Ask your provider and ask whatever hospital you're going to be delivering at in terms of who's tested. I know there have been some questions about whether partners get tested, and currently that's not standard of care at most places to test partners, but certainly ask that partners would share any symptoms that they might be having with folks. In terms of visitor policies, again, that varies by hospital system. I think in the beginning of this pandemic, we were very restrictive with visitors, including for women who were delivering, just because we were really trying to limit the number of people coming in and out of the hospital in order to mitigate some of that exposure and transmission. Now that we have some better information, better sense of how to really protect people and how to prevent that transmission from person to person, some of those policies have loosened up a fair amount. So I would say most places, you can have certainly one support system. So if that's a spouse or a partner, or if you don't have a spouse or a partner, that could be a parent or a friend, but typically everyone's allowed to have one support person during that labor process and after delivery. And then some hospitals are also allowing something like a doula or some other sort of professional capacity person. Some hospitals are not. So this is something where it's really important, if you're planning to have your partner there and a doula, for example, that you check with the place you're going to be delivering and find out exactly what their specific policies are. Lots of questions I get about early discharge. Is there benefit to discharging early from the hospital after you have your baby? And the answer is probably not. So I think that we are really trying to get people out on time as much as possible. And we always try to do that, but I think certainly more in the time of COVID. But in terms of really early discharge, so less than 24 hours for a vaginal delivery or less than kind of 36 to 48 hours for a cesarean section, the risk probably outweighs the benefit. And that's risk both to mom and to baby. So we do lots of newborn testing kind of right at that 24-hour mark, sometime between usually 22 and 26 hours. And those are really timed to be ideal timing. So in perfect case, we would always wait until that long to do those tests. If there's some reason that you really want to get out of the hospital a few hours early, that's something you can always talk with your provider and baby's provider about once you're in the hospital. But once you're there and you've delivered, it's a pretty short stay anyway, so probably there's not a lot of benefit to early discharge. If you have a positive COVID test or your test result is still pending for some reason, it'll be important to clarify with the hospital that you're delivering at what their visitor policy is in that case. And then we'll talk a little bit about rooming in with your baby and about breastfeeding. So back in the beginning of this pandemic, when we had ordinarily little data about newborns in particular, there were recommendations from the CDC and the American Academy of Pediatrics that you consider and really recommended that you separate mom from baby after delivery, so that baby would be in a different room with a caregiver and sort of come in to breastfeed and do a lot of hygiene practices around breastfeeding. But the reality is, as we gather more and more and more data around newborns and transmission, we're recognizing that the rate of transmission from mom to baby is probably quite low. And the data we have suggests that it's somewhere around 2 to 5% in those first few days. And that most infants, the vast majority of infants who get COVID or have a positive test, will not be symptomatic and will not be very sick. So the new recommendations from the American Academy of Pediatrics, and these are just within the last couple of weeks, are that we really try to have baby room in with mom all the time, unless there's some other reason not to, unless mom's so sick, for example, that she can't care for the baby. And that we just try to take some precautions. So it'll be suggested that baby is sort of in their bassinet at least 6 feet away from mom, if mom is the positive person, whenever they're not breastfeeding or holding for bonding or those sorts of things. And then when you are breastfeeding, if you choose to breastfeed or if you're bottle feeding the baby, it'll be recommended that you wear a mask during that time, that you wash your hands really well. If you're using a pump, that you clean the pump parts well. But we certainly encourage breastfeeding. And so I want to say that even if you're COVID positive, we still recommend that you breastfeed. I think the benefits of that far outweigh the risk at this point. And there may even be some benefits to baby in terms of getting some COVID antibodies if you are positive. We don't know that yet. We don't have the data, but there's certainly that theoretical benefit. Just one small caveat, if your baby goes to the NICU for some reason, so that's the neonatal ICU, and you are COVID positive or your partner or support person is COVID positive, it is likely that you will not be allowed to go into the NICU until a couple of benchmarks have passed. And that's because many neonatal ICUs have open bays where there's multiple babies in one room in their own isolate or sort of contained environment, but in one room. And so, and those babies are babies who are extremely at risk of any infection. So premature infants, infants with other difficulties requiring ICU care. Usually, most places will say that if you're positive, if it's been at least 24 hours since you've had a fever without the use of fever-reducing medications, and it's been at least 10 days since either the onset of your symptoms or if you're asymptomatic since your positive test, that you can sort of be cleared. And so at that point, most places would think about allowing NICU visitors. One thing I just wanted to mention too, in terms of preparation for delivery, a lot of these are the same things that we always recommend. But in this case, I think we really are even trying to avoid trips to the grocery store and those sorts of things as much as we can in those first couple 2 to 4 weeks after delivery. So having lots of shelf-stable foods or freezer meals at home that you can access is really important. As always, after you have a newborn, certainly making sure you have any baby supplies that you need so that you're not, running to Target in the middle of the night because you forgot something. And then for moms who take a medication every day, super important that you have at least a 30-day supply of that medication. And that's a great thing to prep before you deliver so that you're sort of all set. And I would say start prepping this really around 35 weeks because you may not deliver when you think you're going to deliver. And some people go much earlier than they imagine. And then I've included a link here and we can share this out in the email that goes out after this, but this is just a nice list of sort of online birthing classes and prenatal classes, childbirth classes, because most places are not doing those group classes in person right now. And so if your facility where you're delivering does not offer that online, this is a nice list of resources that you can access for that. Okay, so now you're ready to go home, and this probably represents you pretty well. You're feverishly sort of Googling information. So we will talk about some of the data we have around babies and around children, and then how to keep safe at home, and also hopefully how to stay sane while you're doing that, which is really a challenge for all of us right now. There is a 5-year-old in my house right now, so if you hear some loud thumping, that's probably coming from his room. So just in terms of infant and child data, so we talk about babies, we talk about siblings. I think those are both important for parents to know about, especially if you do have other kids at home. When it comes to infants, unfortunately, like I said, we have very limited data at this point. So we have some case reports, so very isolated reports of young infants in that first 28 days of life who have died and were COVID positive. I think it's not always clear whether COVID was the cause of death or not. But overall, those are very low numbers. So I just want to say that one more time. The vast majority of infants and kids who get COVID are going to be totally fine. It is one of those incredibly rare viruses that sort of spares infants and young kids. Almost all the time when we think about a respiratory virus, young children are more severely affected than adults are. And this is one of those cases where that's the opposite. And so as a pediatrician, I feel very lucky about that. As an adult, I feel a little more scared for myself, but mostly just really reassured that kids and babies are generally going to be fine. Again, I'll mention only about 2 to 5% of babies. So when mom was COVID positive and they tested baby in that first few days of life, only 2 to 5% of those infants became positive. So I think that's something important to remember, is that, again, most of these babies, even if they're born to you while you have COVID, are going to be completely fine. And then when it comes to young children, they're really less likely to contract COVID, to transmit COVID to other folks. And we're talking about those kind of elementary school age kids, which for most people having a newborn, that's the age of child that they'd have at home, although some people certainly have older kids. So again, it's really about practicing infection prevention procedures with your kids prior to the time that you deliver. So really practicing hand washing, wearing a mask, all the things that we try to practice with our kids anyway, and certainly need to practice if they're going to be going to any sort of school or daycare environment as those open back up. But really important if you're bringing a newborn home to just make sure that your young child remembers how to wash their hands. So we wash for at least 20 seconds. We can sing happy birthday twice. That's sort of the recommended time. And then wearing a mask. And I would recommend if you have young kids that are going to be holding the baby, they always wash their hands before they do that, which we would recommend anyway. And then you may want to think about having them wear a mask as well. And again, masks are recommended for kids over 2, but not for under the age of 2. just a really quick mention of multisystem inflammatory syndrome, which you may have heard of. This is the MIS-C, which is this very scary sounding and very scary sort of multi-organ system inflammatory response that's associated with COVID in children. It is scary, and it is also extremely rare. So again, we've only seen about 360 cases of this as a nation, and only 6 children have died that have been reported from MIS-C in the United States. And in Washington State, we've had less than 10 reported cases total. So not something for most of us to worry about, but just something to mention because I know there are often questions about that. Okay, so what are some of the precautions that we can take? And I wanted to just go through some of the data around the precautions that we can take, because I think we hear all these recommendations and ultimately we want to know how much does it matter that we do these things and how important is it? So wearing a mask, you've probably heard some mixed data. I will say the bottom line is that wearing a mask absolutely has some benefit, and we should all be doing it when we're around other people. The estimates are that it provides somewhere between 30 to 50% decrease in transmission if you're wearing a mask and if the other person is wearing a mask. So lots of questions that we get are, you know, if distancing works, why do I have to wear a mask? And if wearing a mask works, why do I have to distance? Ultimately, wearing a mask is not a replacement for distancing. So distancing is absolutely the thing that makes the most difference when it comes to transmission risk, and we'll talk about that. But mask wearing provides a significant additional benefit. So if you think about distancing and then adding 30 to 50% decreased risk of transmission with the mask, that's quite good compared to doing neither of those things. It is important that we wear them correctly. So they have to cover our nose and our mouth. I see a lot of masks down here when I go out in public. And then we need to clean them properly. So really we should be cleaning our masks after every sort of day or extended use that we have them on. And so for cloth masks, the easiest way to do that, if it's a material that supports that, is to throw that in the washer and then either dry in the dryer or dry outside in the sun. Lots of questions about this because we're hearing a lot about it in the news. There's probably a very small benefit. So in certain cases, eye protection like face shields or goggles is recommended. And typically that is for healthcare providers who are either caring for a COVID positive patient or who have a patient who can't wear a mask for some reason. So for me, I take care of lots of kids under 2. And if they can't wear masks, then it's recommended that we wear eye protection. But for the general public, probably not a huge benefit. And so not recommended to do universal eye protection at this point. Washing your hands is really important anyway when you have a newborn, so this should not be new practice to anybody who's bringing a baby home, but it really does kill the virus if it's done right, and so that means at least 20 seconds, and it means warm, soapy water, and it means getting every part of your hand. So a lot of people I see kind of stick their hands into the water, scrub around, and then they're done. You really want to make sure that you're not only washing your palms, but you're really getting in between your fingers and the backs of your hands, and then your thumb, which is the place everybody always forgets. So this is just good hand washing technique in general when you have a baby at home, and certainly more important than ever. If you can't wash your hands, which is the best method, then if you use hand sanitizer, it should be at least 60% alcohol. Okay, so now distancing, which is again the most important thing when it comes to prevention of transmission. So if you are at least a meter apart from someone else, which is about 3 feet, it's just over 3 feet, that decreases the odds of transmission to about 20% of those odds if you're closer than a meter. So that sort of 3 foot is one magic distance. We hear a lot about 6 feet, and that's because every meter after that provides about half the risk of transmission again. So if you can get to 20% of the risk by being 3 feet apart, then if you're 6 feet apart, you can really get below 10% of risk of transmission as if you're right next to each other. And I think that's really important. This is probably the most important thing we can do. And frankly, it's something we do anyway when we bring babies home from the hospital, just sort of naturally, but I think we're especially thoughtful about it right now and more intentional probably than typical. So just moving on a little bit now from the data and the numbers, and just talking about sort of how do we find our village now in this time. You know, we're used to having people stop by to visit and see the baby and drop off meals and get together with parent groups and friends who have similar age children and have grandparents come. And there are still ways to do some of those things, but we'll talk about timing and how to do that safely and really how to find that support in this time when all of us, I think, are feeling really isolated and kind of having our worlds just turned upside down. So again, safest thing would be to just completely stay away from everyone in terms of COVID, but I think the safest thing for our mental health is to think about some harm reduction strategies that can help mitigate some risk, but also allow us to feel supported and feel like we have a network of people that we're depending on. So that first 2 to 4 weeks, I do think we just have to be really strict and really vigilant. So really no visitors for the first at least 2 weeks. If you can get to 4, that's ideal. And part of that is related to COVID, and part of that is just having a newborn who is very susceptible to lots of the other things that are not COVID that tend to float around in populations. Lots of people have started thinking about doing these pods, so kind of forming pods of families, 2 or 3 families who socialize with each other only, but nobody else. So it's sort of that closed loop. Certainly makes things easy if one person gets symptomatic to kind of monitor the other people, but it does provide some benefit in terms of socialization and experience sharing and all of that. And certainly for kids, this can be helpful too. I think it's important to mention adults really can maintain that distance quite easily. It's obviously much harder for kids, in particular young kids. But I think the silver lining here is that young kids are less likely to get or transmit COVID. And so we still want to keep them distanced when we can, but certainly have to worry more about older children and adults. If kids in this pod are going back to school next month or are already back in a daycare situation, it does make things more difficult. So that really increases the pool of folks that the pod is then exposed to. And I think that's something that you just have to think about. This is obviously a really individual decision for every family. So this is something you just have to kind of have some hard conversations around and really figure out what works best for you and your family. This really requires that everybody in that pod has similar views about being protective, about infection prevention. It requires that everyone is very transparent and honest with each other. And sometimes those conversations are going to be a bit uncomfortable in terms of what folks are okay with and what they aren't okay with. But if you can find people that are like-minded, I think this can be one strategy that can really be helpful. And then tons of questions about extended family, in particular grandparents visiting. So I will just say air travel is not recommended for really anyone, but certainly for older adults right now who are more at risk. And so those are folks above 65 or who have any kind of underlying medical condition. If they can drive to come to you, that is definitely better as long as they can avoid a lot of public places along the drive. So it doesn't help so much to drive if you're stopping at, rest stops and staying in a different motel every night and going out to dinner in a restaurant and those sorts of things. But if there's a way to drive and be pretty self-contained, that's definitely better than flying. You really have to think about what the prevalence is in your area. So if you live in a place where COVID is rampant, it's probably not a good time to have your parents come and visit, not because of the baby, but really because of your parents, and really protecting those older adults. And then again, the ideal situation, and as doctors, we give a lot of ideal recommendations, and then we sort of talk about what does real life look like. But ideally, everybody, so you and your parents or whatever relative we're talking about that might be coming to visit, would sort of quarantine for 2 weeks prior. So really not see anybody socially or grocery store outings or that sort of thing for 2 weeks prior to visiting, so that you can be fairly certain by the time that 14 days is up and you're coming together that anybody would have developed symptoms or become positive and then pass that kind of clearance period if they had been exposed prior to that quarantine. So that's the ideal situation. Just a note about vaccines. So vaccines for things like flu and pertussis are still very, very important for anybody who's going to be coming in contact with the baby, because those are things that actually can be very harmful to young infants. So flu, pertussis in particular, but certainly general vaccines and having those up to date is really important. And then you may want to think about if there's potential to do sort of an extended stay rather than back and forth. So even if your parents or your relatives live relatively nearby, if they can come and stay for 2 weeks or come and stay for a month, that is much lower risk than if they're sort of going back and forth between homes or between towns. And then drive-by visits, I think, are something that we're all getting used to. So, you can be on the porch, someone can sort of drive by, get out of the car, stay more than 6 feet away, ideally 10 feet or more, but see the baby, have a conversation with you, just provide that little sort of moment of support and community. I think that can be a really helpful thing. And then Talking about sibling care, again, this is a completely individual decision for your family. So it depends how many kids you have at home, but in terms of what sort of care setting they might be in during the time when you have a newborn, that's something where you really just want to weigh the risk and the benefit. And I wish I had a hard and fast answer for you. We're sort of thinking about this in our house, is what is the risk and what is the benefit of kids being back in those care settings, both to that sibling and to the parents who are trying to deal with a newborn and a toddler, or a newborn and an elementary school age kid at home. But then also, what is that risk and sort of what precautions is that care setting taking to make sure that kids are as protected as they can be from COVID in those groups? And happy to take questions about those as well. And then when we think about our own mental health, I just want to make a note about postpartum depression. So this is something that I think we are getting much more comfortable talking about, and I hope that we are getting much more comfortable talking about and sort of decreasing that stigma around. It is quite common. So about 1 in 8 women will have symptoms of depression after delivering their baby, true depression, not just baby blues, and we'll talk briefly about the difference. And so this is something that is really common. Absolutely, it is not something anyone should be ashamed of. It's something that should be addressed, and it's something that can be treated, both for the good of the mom and for the entire family, including that newborn. So those baby blues are very common. They usually start a couple of days after birth, and often this can just be related to sort of hormonal changes and exhaustion and fatigue and all those things. You may be worried or feel unhappy or really tired. Usually that gets better within a couple of weeks. So if you're getting past that 2 or 3 week mark and you're still having persistent symptoms, definitely time to talk with your doctor about that. True postpartum depression usually starts, this is from the CDC, 1 to 3 weeks after birth. I'll just say in my experience and my practice, this really can be anywhere up to a year. So most of the cases will happen in the first 3 months, but there's often another peak as we get closer to a year. And so really we need to be mindful of this, sort of at least for that first 12 months postpartum. This is really more intense symptoms of sadness or anxiety or feeling hopeless. It kind of interferes with your ability to live your life every day. You may feel uninterested in activities that you generally enjoy. You might kind of withdraw from friends and family, including your partner. Some people, very few people, but some people will have thoughts about hurting themselves or hurting the baby. That's often what people think about when they think about postpartum psychosis, for example, which is another postpartum mood disorder. But this is more common than we think, and it's something that we need to talk about for sure if it's going on. And then again, this can happen up to a year after birth, and typically does require treatment, so either medication or counseling or both, ideally together. So thinking about how we care for ourselves and how we put our own oxygen mask on, which as women and parents, we are terrible in general at doing. I do think sometimes the idea of self-care with a newborn at home seems totally laughable. And then we throw in a pandemic and it seems just insane to even consider that we could do this. But I do think it's important to think about those tiny ways that we can take care of ourselves. So this is a time when everybody is struggling. And I think that everyone has their own struggles, but we know that about 13.5% when we talk to US adults now in 2020 are experiencing actual psychological distress. So depression, anxiety, other symptoms, and that's up from a baseline of just about 4% in 2018. So there is a real increase that we're all aware of, right? I mean, I think we have financial considerations that are new. We are totally isolated. We're wondering what the rest of our future is going to look like. How long is this going to last? We're sort of trapped at home with kids and trying to work and doing all sorts of things. And it's very, very challenging. So if there are ways that you can seek community right now, I think it's very important. And that might be virtual. And so honestly, the fact that you're here at this webinar is probably a great thing to think about. Are there other sort of classes or groups that you can get involved in that are digital right now, but may translate to in-person as things sort of calm down? And then there are virtual care options for mental health as well. So when we think about things like postpartum depression or other mental health issues, there are often options, and more now than ever with COVID, options to do appointments and have care for those issues in a virtual way. So you don't have to leave home. You don't have to think about how you're going to schlep the baby and all this stuff, and your partner's at work and all of these things. I think it's actually more accessible than ever right now to get access to that care. I did put a link here. Swedish has something called the Center for Perinatal Bonding and Support, which is a really incredible resource for women who are postpartum and who are having, or prepartum, frankly, and who are having any symptoms of mental health issues, depression, anxiety, those sorts of things. They just have incredible resources. They have a partial, like a day hospitalization program for people who are having more severe symptoms, but lots of other resources for people who are having these much more common sort of 1 in 8 women type of symptoms. Meal trains, I think, are something that we're all used to with newborns and with other life events, and those certainly can continue. I think if someone wants to drop dinner on your porch, they're not coming in the house, they're not eating with you, they're not visiting with you close at a distance, that is probably really safe. And I think that's fine to continue, and that's something that really can provide needed support to people. We know there's also lots of ways to send gift certificates for delivery food and those sorts of things. And so I think that's something we should continue to support each other with. And then lactation support is something that still is really important, and most places are providing virtual options for that now. So again, you don't, breastfeeding is something where it's certainly easier in person, but there are lots of questions that can be answered on a virtual visit, and that helps eliminate some of those frequent trips back into the hospital or the lactation care setting. Just a couple notes that I think that I have learned, and I think other folks have learned. 10 minutes really can be magic when you have a baby at home. And by that, I mean, it sounds really trite and it sounds really silly, but if you can truly find 10 minutes once a day that your partner or another support person can care for that baby so that you can have a cup of tea or walk around the block or talk to a friend or take a shower, which is really hard to do when you have a baby at home. If you can just find 10 minutes for that once a day, I think it's incredibly helpful for your mental health. Like, you just need a tiny break. It is also fine if your baby is crying to put them down safely in their bassinet or their sleep environment and walk away and take some deep breaths and take a moment for yourself. It is not only fine, but it is encouraged. I think that it's really important that we can't be all things to all people all the time, and we actually have to take care of ourselves. Sunday meeting is something that we do in my house that I think is really important and probably ever more important when you've got a baby at home. But this is something to think about as one or both partners go back to work, which is just sitting down together on Sunday night before your week starts, looking at the week together, figuring out where you can help each other out. Where are those crunch times where you both have a meeting, or the baby's going to be crazy and your partner's got to be in a meeting for work, or someone has to be away from the house for a while, and think about how you can help each other and what are those resources you can call on during those times. There are always going to be things that come up last minute that are unexpected, that are sort of crises, but I think the more that we can plan for the things that we can plan for, the more sort of reserve we'll have when those difficult situations come up that we haven't planned for. So I think this is a great practice just in general, to sort of have that Sunday meeting with each other, think about what are the tough days and tough times going to be so that you're kind of mentally prepared for them, and then think about how you can help each other out in those other times. And then this is really just a time to give ourselves grace. Nothing is going to be perfect. This is like newborn magnified, right? Because I think when we have newborns at home, the house isn't clean, the food isn't what we want it to be. It's just life. We haven't showered a lot of the time. But then you add in COVID and it's just even worse. So I think this is just a time to recognize that we need to be okay with not being perfect. We can't let perfect be the enemy of the good, and we have to focus on some of the positive things. And there are some silver linings when it comes to COVID. I think we talk a lot about the doom and the gloom and the difficulties, and certainly there are plenty of those. But there are some things that I think we can actually take advantage of during this time. So you probably will have more time with a partner if you have a partner at home and a newborn at home than you would in normal times. I think lots of people are working from home. Lots of people are working less. Or working more, but at least doing it from home. And so you'll have more time together, most likely. Your partner may be able to stay home longer than they typically would to kind of provide some of that support. We are getting so much better at connecting with each other virtually, and newborn land can feel like a very isolating time, even in the best of times. And so I think one of the silver linings here is that we are so much better at doing Zoom calls and group chats and Zoom happy hours and drive-by visits and all those sorts of things that we talk about. You might actually find that you're talking to friends or relatives who live far away more often than you would pre-COVID, when we weren't used to doing that quite so much. I mentioned telemedicine. I think this is a huge silver lining. We have made great strides. We really have kind of come years ahead of where we were just in the last few months in terms of providing virtual visits for lots of different specialties. And then I think there are just fewer infectious illnesses going around in general, with the exception of COVID. So even though we are scared and worried about COVID and it's something to take very seriously, there's less flu right now. There's less RSV. There's less bacterial infections that people are passing back and forth just because we're not around each other as much. So in some ways, it's actually quite a healthy time to have a newborn when we think about those other risks. And then the last thing I'll just say here is that I think this is a time where you may find that you have a much easier time breastfeeding, because even if you go back to work, you're home typically for many people, not for everybody certainly, but for the people who do work from home during this time, breastfeeding is much easier when you're working from home, frankly, than it is when you're in the office and you have to find a place and bring all your supplies and find a place to store milk and all of that. So I think there are a few positives to focus on. And then a really quick note, what if you are COVID positive? So again, not many babies will test positive, which I think is great. In pregnancy, you will be just really carefully monitored. Delivery, we talked a bit about this, but you want to make sure if you're known to be COVID positive and you're getting close to the time of delivery, you want to really talk with your provider about whether your support person can be there, what the restrictions are around that. And most places are allowing it, just to kind of reassure that, but there may be pretty strict restrictions on that person coming and going from the room, for example. We talked about having your baby still room in with you, even if you're positive, and just taking precautions around that, and continue to breastfeed, certainly. And then again, hospital staff are just being extremely careful, but just be aware that if you're positive, people will have sort of N95s, to potentially face shields on for sure. And so it can just look a little bit scary, but those are really all things that they're doing to protect you and protect other people around. Once you go home from the hospital, it's important to keep masking, keep doing hand hygiene and all those infection prevention things, again, until you've had no fever for at least 24 hours and at least 10 days since your symptoms started, or since your positive test if you never had symptoms. And then again, absolutely avoid contact with anybody who doesn't share your household during this time. And then to think about follow-up, there will probably be pretty frequent visits for you and baby if you're known to be positive, just to sort of monitor that. But many of those can be done virtually. And in fact, most of them should be done virtually if you're COVID positive. And then there is no repeat testing required. So I get a lot of questions about, if you're positive, do you have to kind of have negative tests to be cleared? The answer is no. We assume that once fever's been gone for 24 hours and you're at least 10 days again from that onset, that you are sort of determined to be clear. You don't need to have negative tests to do that, except for some very specific cases, which don't apply to most people. So here are a few references. I will stop there and see what questions I can answer.
Okay, Elizabeth, first of all, I cannot thank you enough on behalf of, I have yet to see in the number of Zooms that we've had, the numbers actually rise as you're speaking.
Oh, good.
Usually the good news is the numbers don't go down. The numbers actually rose, which means there were people watching you, contacting their friends to get them on. So thank you for packing in an extraordinary amount of—
I know I talk fast, so yeah, I'm sorry.
No, useful and, really loving information.
Okay.
So I am going to try to pack in a bunch of questions.
Okay.
First, a bunch of people are asking questions about children that they have that want to send to preschool, want to send to school in the fall if there's some kind of hybrid situation,
Yep.
And what your recommendations are on that.
Yeah. So I do think just the caveat here is that it is a really individual decision for families. And I know I mentioned that. I mean, we're thinking about this in my family right now. I think that with young kids, again, the risk to kids is quite low. So most of our concerns, and so I'll put on my kind of American Academy of Pediatrics president hat, most of our concerns really are around protecting teachers and staff. When we think about reasons not to send kids back to school, it's less about the kids themselves. And so I think that we should worry not so much about sending our kids back to school if we feel like there's a safe environment for them to go back to care in. The one thing I'll say is there probably are some additional precautions that you want to take in your home if you have a newborn and you're postpartum and you have a kid who's in some sort of care or school setting. And so some of those things include things like having 1 or 2 pairs of shoes that your kid wears to school that they take off and leave on the porch before they come in the house so they don't wear them inside. Absolutely wash hands as soon as they get home. You might even want to, if you're being really careful, which we do this in my house, like when I go to the hospital, I came home and I just take off the clothes I was wearing, they go straight in the wash, and I I actually shower, but I don't think kids need to do that. But you may want to just have them change their clothes when they get home from school, certainly before they hold the baby or do something else. So there are kind of extra precautions we can take. And then again, kids who are in those settings are going to be required to wear masks. So I think that risk of transmission is actually fairly low if kids are going back to care settings.
Great. Now, there's more following up on that, questions around like, so if those kids, should those kids that go to school or preschool, when they come home and they're with this newborn, should they be masking up?
I think it's a really difficult question. If they're holding the baby, and I would say especially in that first 2 to 4 weeks of life, if they're holding the baby or getting really close, yes, ideally they would be wearing a mask again if they're over the age of 2. For kids under 2, if you have a 1.5-year-old at home, let's say, we don't recommend that kids under 2 wear a mask. But for kids over 2, yeah, I think if they're in care settings in particular, so they're interacting with a decent number of people outside the home, again, for that first 2 to 4 weeks, I think wearing a mask is great. After that, you can probably loosen up a little bit. But to be honest, I mean, in my experience, we have a 5-year-old at home. He just doesn't even care anymore. He's totally used to the mask. He leaves it on. Sometimes I say, you can take it off now. And he's like, no, it's fine. So I think kids are actually much more adaptable to this than we are.
Thank you. You mentioned, this is a non-COVID question. You mentioned the vaccine that you want to make sure if anybody's visiting the family should have. And I answered it, but I don't want to get it wrong. So what is
So people should be up to date on their vaccines in general. We did have a measles outbreak in the state last year, so making sure that people are up to date in their general vaccines is really important. If you have someone who's totally not vaccinated, I would consider that a real risk to be around a newborn, absolutely. The 2 that we recommend that people make sure they're up to date on are the pertussis vaccine, so Tdap, and then the flu vaccine. And we're a little early right now for flu, but as we get into September and beyond, that will be offered for people. And so those are the 2. Moms typically get those during pregnancy. I absolutely recommend that the non-pregnant partner get those as well. And then anyone who's going to be coming into close contact with baby, those are the 2 you want to make sure they've had it updated.
Great. And I think you said there were some questions about masking up during delivery, but I think you gave a no to that. Or what was the answer on that?
If the mom should mask up while she's delivering? Yeah. So again, many moms will be tested. If you're known to be COVID negative, they may not require that you wear a mask during delivery. If it's unknown, they probably won't, to be honest. Most places are not doing that because the care team is all messed up and they have protective equipment on. And so, but there is a situation where any visitors are typically asked to have masks on. And it may be that after you deliver, if someone comes into the room, for example, that you're asked to wear your mask while the provider is in there talking with you.
One woman said, my husband's job doesn't allow for him to isolate really in any way for 2 weeks before the baby arrives.
Yeah, I think that's the case for many people. I will also say that I think one of the reasons that we talk so much about wearing masks and washing hands and taking all of these effective prevention measures, and it's because we do those things. I'm a physician and I see patients all the time, and a number of them are COVID positive. The rate of transmission to healthcare workers, if they take the appropriate precautions, is very low. And so I think that can kind of be reassuring to all of us. So ideally, people would sort of quarantine and isolate. Lots of us don't have a job that allows that. I think some of those precautions, again, like wearing a certain pair of shoes, leaving it outside, not bringing it in the house, potentially if you're around a lot of people, like if your partner's around a lot of people at work, the ideal situation is that they take off their clothes when they get home, they take a shower and put new clothes on. It's a little bit onerous, but it really does help protect.
Great. There's a couple questions about co-parenting and multiple households and protecting, you have your pod, they have their pod. Can you just speak to that a little bit?
Yeah, sure. So if you have a child who spends part of the time at your house and part of the time in a different house, you really have to think of each other like one pod. And so it doesn't mean you can't both have a pod that you interact with, but I would keep those quite small. So if you would normally, let's say, have 3 families that have, 5 kids in your pod, you may want to think about, do you each have like one other family that you can interact with? And I think the thing about pods, and I'm not sure if I said this, you really have to commit to not socializing with other people outside of that pod. So if you're truly going to form a pod with each other and you're going to depend on each other in that way, and you're going to have close contact with each other, then you need to know that folks are not doing that outside of that situation. So I think co-parenting can absolutely work. You have to be really honest and open with each other. The difficulty, I think, is when one household takes things very seriously and one household doesn't. And that's really, really challenging. And I just want to acknowledge that. I don't have the easy answer for that. But I think that those co-parents have to be willing to have very open conversations with each other. And it's okay to say, you know, we have a newborn that's coming into this home. We have to be really extraordinarily careful right now. And I'm going to ask the other person to limit that outside contact or socialization for at least those first couple of weeks. I think that's a really fair ask.
Thank you. Interesting question on masking up and social development for new babies. It's sort of like our iPhones don't facially recognize us anymore. Are there any early studies or studies on the impact of that?
I wish we had that data. It's something I'm absolutely thinking and concerned about as a pediatrician, not just for newborns, but even for like preschool age kids who really get a lot of social development from facial expressions. One thing we've talked about, so like in daycare or teacher settings, if teachers can have clear face masks, that actually is a huge bonus for kids who are interacting with those people. You know, at home, unless you're COVID positive, you don't necessarily you don't wear a mask really around your baby. So if you're COVID positive and you're masking, that again is pretty short-lived. It's usually just a couple of weeks, and I don't think we should worry about that at all in the long term. But babies really learn most of those cues from their parents' faces, and so I think that you're going to be fine when it comes to that. But we do worry a lot about that kind of early learning, 2, 3, 4-year-olds and how they're going to react to this. And I think, unfortunately, we don't have that data because it's so new. It's going to take us a few years to really understand that.
Right. There's a bunch of questions around, you know, you address grandparents coming in from out of town, and if they, you know, can't quarantine or isolate for 14 days, what's the testing procedure? Like, what's the timing between when they get here and they should be tested?
Yeah.
And then they're all clear?
Yeah. So test access is something that that informs the answer to this question. And so it partially depends where they live and where you live and what that access to testing is like. In the ideal situation, to really feel like you're clear, you would have a negative test that is 14 days after your last sort of contact with someone else. And that doesn't necessarily mean like you went to the gas station and pumped gas, but it means that you had some sort of situation where you were in close contact with another person. So if they can't quarantine, many people are having grandparents sort of come to their house, and if you're fortunate enough to have a separate space for them to hang out in for a while and not get too close and then have a negative test, that's an option. But the data-based answer, the evidence-based answer is that a negative test 14 days after potential exposure would really be what you would need to sort of feel like you were in the clear.
Great, thank you. I think we've raced through all the questions. Fantastic amount of information, and you're really a tremendous resource. So I hope you can come back and visit with us again soon.
Happy to. I mean, I think that's the thing about this, and I think that's the struggle for us in healthcare, but absolutely the struggle for every person is that the information is changing really fast. And so we do the best we can, we keep up to date, but there's always new information. And so, yeah, we're happy to come back for sure.
And I mean, I'm just fascinated as a soon to be on Tuesday grandmother for the second time at Swedish Hospital. You know, I feel like my daughter's gotten tremendous care and tremendous information along the way.
Right.
And it's changing every other day. So I think, you know, that's all of our responsibility as grandparents and soon to be parents and second time parents. You just have to stay on top of it. And I can assure you that we at ParentMap will do our best to keep elevating that current information.
Yeah.
So.
No, that's absolutely right. And I think that's a nice note to end on, which is you have to ask those questions. And, you know, pregnancy and early parenthood is always a time where you are your best advocate, but this is a time where I think that's especially true. So you really like stand up for yourself. And if you're not getting the information that you need, you ask someone else, you find a way to get it. You need to feel comfortable with the things that are happening during this time. And I think that, I know that at Swedish, we really try to get information out when you get there. We tell you what to expect. The doctors explain it, but that's something everyone deserves. And I think if you're not getting that, it's really important important to raise that and to make sure that you're getting all of the information that you need. Even though it's changing, we can certainly give you sort of our best knowledge for that time.
Fantastic. Well, I want to thank our sponsors again, Swedish for partnering with us, you, Dr. Meade, for your precious time. And we look forward to having you back.
Thanks so much.
Thank you.
Take care.
Bye-bye.